Hi, everyone. Welcome to our new webinar series, Oncology Nurse Hour. I'm Amanda Holman, and joining me today is Kristen Johnson, our Chief Nursing Officer and Oncology expert. We work for Massive Bio, a concierge clinical trial enrollment service where we connect patients to clinical trials. We're here to discuss cancer types and answer any questions you want to know. This week's theme is myelofibrosis. Based on community input, we've created a Q&A, and in a few minutes, we'll be going through some questions. However, I want to encourage you to write into the chat any other myelofibrosis questions you have during the event, and we'll spend some time making sure to answer those as well. Before we begin, Kristen, can you tell us a bit more about yourself?
Sure. Thank you so much, Amanda. I'm excited to be here. Hi, everyone. As Amanda mentioned, my name is Kristen Johnston, and I'm a nurse with over 12 years of oncology experience. I have knowledge in both solid and hematologic tumors with direct patient care, as well as extensive clinical trial experience, including trial recruitment and enrollment. And again, I'm so excited to be here today.
And we're so glad you're here with us. With that, I guess let's jump into some of the questions.
Great.
So to kick us off, can you just explain what myelofibrosis is?
Sure. That's always a good way to start. Myelofibrosis is a rare type of cancer in the bone marrow. It occurs when the DNA of a blood-forming stem cell is damaged, which is called an acquired mutation. When the mutated cell copies and divides, it begins to multiply uncontrollably, creating more and more abnormal blood cells that are called blasts. This stops the bone marrow's ability to produce normal, healthy cells. Myelofibrosis usually develops slowly, and many patients don't have symptoms for many years, while others may develop symptoms that progressively get worse, and then treatment is required.
Thanks, Kristen. Would you be able to tell us, are there different types of myelofibrosis?
Sure. There are. Myelofibrosis is actually considered to be a chronic leukemia and belongs to a group of diseases called myeloproliferative disorders. Myelofibrosis can occur on its own, which is called primary myelofibrosis, or it can develop from another bone marrow disorder, which is called secondary myelofibrosis.
And I'm guessing that there are different symptoms, and there are a lot of symptoms for myelofibrosis. Would you be willing to go into some of the details about that?
Sure. You're guessing right, unfortunately. But as I mentioned previously, myelofibrosis usually develops very slowly. So oftentimes it does not cause symptoms early on. In fact, many times myelofibrosis is diagnosed during routine blood tests. So the extensive scarring that myelofibrosis causes in the bone marrow, however, can lead to severe anemia, in turn causing weakness and fatigue for patients. Other symptoms that can include pain or a feeling of fullness on the left side due to that enlarged spleen that can occur. Night sweats and frequent infections are also pretty common. And there are other symptoms that are not as common as well. But the goal of treatment for myelofibrosis is to decrease or relieve these symptoms and reduce the risk of complications that can be associated with myelofibrosis.
So it does seem like, symptom dependent, things will change as you go, but you can live a pretty normal life with myelofibrosis for quite some time.
Absolutely. If it's caught early and it's monitored and, you're being followed by your physician, absolutely.
Is there a best diet for myelofibrosis?
I think that's the number one question, Amanda, and that's always burning in everybody's mind is what can I eat and what is allowed? But there's no specific diet that needs to be followed when you're diagnosed with myelofibrosis. But as with all cancers, eating a well-balanced diet that's rich in anti-inflammatory foods like fruits, vegetables, whole grains, healthy fats that can lower inflammation that is many times associated with myelofibrosis are the best foods to eat. Processed foods or high foods or foods high in sodium or sugar or saturated fats should be avoided if possible, but that's the same as in everyday life, I'd say too, right?
Absolutely. I feel like we're always trying to eat less inflammatory foods to help us out. So along the lines of, managing symptoms and having a good diet, living your life, what are the common therapies for myelofibrosis?
Sure. That's a good question. And so, as I mentioned earlier, the goal of treatment for myelofibrosis is to decrease or relieve symptoms and to reduce the risk of complications that are associated with myelofibrosis, right? So, there are targeted treatments called Rexelytinib, and that's also known as Jakafi, or Fedratinib, which is also known as Inrebic. And they are used to target the JAK2 gene mutation that is found in about 50% of primary myelofibrosis patients. So these drugs are used to reduce symptoms of that enlarged spleen that we had talked about earlier. There's also clinical trials available utilizing these medications in combination with other drugs to aid in the treatment of myelofibrosis or provide somewhat of an enhanced effect. A bone marrow transplant is another option that can provide patients a chance for a cure. However, this treatment can vary because it's very hard on the body, and it's not an option for many or even most myelofibrosis patients. And then there's chemotherapy or removal of the spleen, which is also known as a splenectomy, and radiation therapy. They're all options that can be considered for the treatment of myelofibrosis as well. However, I would like to mention that clinical trials can also be considered at any stage of the treatment process, but we'll get into that a little bit more later.
Definitely. Would you say that some of the more extreme treatments that you mentioned at the end there happen after you've tried some other methods first, including clinical trials, or does it depend case by case?
Not necessarily. That is really dependent on the case, as well as how high of a risk you are, if you're low or intermediate or high risk. So definitely consult your doctor, and that way they can go over the other treatment options with you.
So you mentioned that one of the main treatments for myelofibrosis is Rexelytinib. Would you be able to talk about some of the common side effects of this drug? That was a common question we had when we reached out to the community.
Sure. So Rexelytinib is also known as Jakafi, and it's a targeted treatment, as we had discussed, that's used for intermediate or high-risk myelofibrosis. So the side effects can include low platelet count, anemia, low white blood cell count. However, the dose can be adjusted according to these side effects. So your doctor will monitor you with blood work in other ways to see, make sure the drug is still being effective and not taking a toll on all of your blood counts as well.
Makes sense. Do you know how long it will be effective on average if the person has later stage myelofibrosis?
Sure, that's a good question. The length of time that a patient can be on Rexelytinib and have it be effective varies from patient to patient. Every case is individualized and different. But the good news is that if patients are starting to find that Rexelytinib may be starting to be less effective than before for them, there are clinical trials available that may enhance the treatment effect of Rexelytinib. So many options that can still be effective during that time and can be discussed with your oncologist.
For all the viewers out there, if you are considering clinical trials, make sure to check out the Facebook chat. There will be links to different guides you can download, and we're happy to help you start your process.
Absolutely.
Do you know, you've mentioned clinical trials quite a bit. What are some of the newest myelofibrosis therapies out there right now?
Sure, I can discuss that. And I will mention clinical trials again, of course. But there are many different treatments currently being studied in clinical trials that can potentially be effective for the treatment of myelofibrosis. Targeted therapies, as well as treatments to manage the symptoms, are all areas of interest right now for researchers. So in order to have access to the newest treatments available, consideration of a clinical trial might be the best option.
And finally, can you tell us what caregivers can do to help myelofibrosis patients?
Sure. Caregivers play a key role in supporting patients throughout their cancer journey. I truly can't stress that enough. They can help patients do research for treatment options, such as clinical trials or targeted therapies, or they can simply just be that silent support that patients need so much and long for. But by helping patients find the next best treatment option, the caregiver can take that added and undue stress off the patient so that they can focus on improving their outcomes without needing to do research and everything else that comes with that.
I think having a support system is always a helpful thing.
Absolutely. Absolutely.
So that concludes the questions we received ahead of time. If you do have any questions about myelofibrosis, feel free to pop them in the chat now. You're also more than welcome to reach out to our team at any time, and we're happy to help you. Kristen, I think, is there anything else you wanted to talk about myelofibrosis?
Nothing from me, just that, as Amanda had said, we are more than willing and happy and excited to help patients throughout their cancer journey with myelofibrosis and help them to search for that best treatment option for them. The patients come first in our eyes. And so any way that we can help facilitate anything for patients, please feel free to reach out and send us questions. And if you can't think of any questions right now, we're always available for those follow-up questions too.
Absolutely. So we want to thank everyone. This was our first time doing this Oncology Nurse Hour. This will be a web series we continue to do. So please come back, tune in, and we look forward to hanging with you all again. Thanks a great rest of your day. All right. Goodbye, everyone.
Bye now.
Oh, we have a question before we hang up very quickly.
Oh. All right.
Nancy would like to know, how can the extent of myelofibrosis be monitored?
Sure. That's a good question, Nancy. So the extent is monitored with scans or laboratory workup. So we can check your spleen size to see if the spleen is enlarged and how much more enlarged it is. When you're first diagnosed, your doctors will likely check the size of your spleen at that time and then follow if it's getting larger or smaller. And that can be a determination of if your myelofibrosis is getting worse or getting better. Additionally, laboratory workup. So your white blood cell count, your platelet count, your hemoglobin count, all of those are taken into effect and monitored along with that to make sure that the treatment that you're on, or if you're getting active surveillance, just being watched, that is the best option for you at that time.
So it sounds like there are quite a bit of ways to make sure you're staying on top of your care.
Absolutely.
Nancy, thank you so much for your question. Congrats. So Nancy has commented that was done 6 years ago.
Wow, that's great.
All right. Thank you again, everyone. And please, do not hesitate to reach out.
Absolutely.
Have a wonderful day.
Bye, everyone.